All right, now we're recording. Okay, so I'm here today with Dr. Brown, who is the country director of ADRA Ghana. And we're actually working, ADRA UK and ADRA Ghana are currently working together on a program to do with cashew farming and increasing incomes and improving livelihoods through cashew farming in 3 regions, is that right, of Ghana?
We are in 3 regions, yes. I mean 2 regions. Now it's 3. When we started, it was 2.
Exactly.
But since then, we have had additional regions. So now we are working in 3 regions. You are right.
Perfect. Great. So, and this project it started last year, right? And it's going on for this year.
Yes,
and
for 3 years. Yes.
For 3 years. Great. And today we're just going to have a bit of a conversation about how things are going in Ghana with regards to COVID-19. So I guess the first question is, what's the current situation in Ghana?
Okay. Yes, Daria, we thank God. So far, the situation, sort of, the fear and the panic has sort of slowed down. Initially, the way it was rising, people were panicking. And so it wasn't a good experience. However, I must say that yesterday we came out of lockdown experience.
Oh, wow.
21 days of lockdown.
Oh, wow.
So we are now out. Yes. And so now we can go to our offices and do our businesses. However, we have to continue to observe the protocols, social distancing, wearing masks, and those kinds of things. They are still in place. We have to follow them. I must say, in terms of figures, as at yesterday, Ghana has confirmed cases of 1,042. 1,042 confirmed cases. Then we have 99 that have recovered and 9 deaths. So that's the situation now in the country. As I said, now we can go about our various activities. The restrictions have been lifted, so market women can go, offices can operate. Now, in our office, we also have had to show some concern for our staff. I mean, some protection, and therefore we set up a COVID-19 Prevention Management Committee, a 5-member committee. And daily they are giving us updates and reminding our staff that as to what we should be doing. During the lockdown period, we were working from home. Most of us, middle to senior management staff, were working. In fact, we were writing proposals, submitting them. And so we did that. But now that it's been lifted, tomorrow we are resuming. So staff will come. However, we want to still work out a plan so that those who don't need to be in the office don't even come. They can continue to operate from their homes and then be reporting so that we can have the organization run. And so that's for the staff. And of course, those who come to the office, we've made provision that they will be wearing masks. So from tomorrow, if you zoom in to see us, you'll see us with our masks.
Oh, shame. We should have done this tomorrow.
So, but the other things like Veronica bucket before before entering the office, and then sanitizers, those are always in place. So there's no problem with that. Okay, so that's basically for our staff. And let me also say that during the lockdown, it wasn't the entire country that was under lockdown situation.
Okay.
We had, yes, it was Greater Accra and its environs, and then Ashanti region and its environs. And so the other places could work. However, the requirements were supposed to be followed, like the social distancing and not having funerals. You know, if you have funerals, not more than 25 people, those are still in place. Schools are still not reopened. Yes, and then you also have, of course, those areas where I said they could work. Still, people were not working because they were scared, and yeah, they were scared, and they didn't know who has it and who would infect the other. So people were a bit scared, and so it was actually affecting many other activities.
Okay, okay. But you mentioned, so it was mainly the kind of the big urban centers that were on
because initially most of those that were confirmed were coming from only these two regions. Greater Accra region, which has always had the highest, because it's the entry point. You know, most of our cases were mainly imported.
Yeah.
But now it's beginning to have the horizontal dimension where we are infecting, I mean, people are infecting the locals. So that's the situation. That's why there was the lockdown, so that they could do more of the contact tracing.
Yeah, okay.
Yes, it was for that purpose. And they've been able to track so many, and they've tested. In fact, that's the reason why our numbers have gone up. It was as a result of the contact tracing that our numbers have gone up. March 12, we had only 2. And today we have 1,042. And so, yeah. And so now we are sure that the spread has gone down a bit, and but still we are we are being very careful. Yes.
I wanted to ask actually about testing and contact tracing. So they've been using those kind of methods to.
Yes, they have. Actually, in Africa now, Ghana is leading in terms of the testing. Yeah. South Africa was, but now we've looking at in terms of population size ratio. Proportionately, we are leading in terms of our testing. So that's where we are. Yes.
Nice. Okay. Okay. And I wanted to ask a little bit about the projects that you currently have. So we've mentioned the one with ADRA UK, but I know you also have, I forgot how many you have, like 4 or 5 projects?
Okay. We have other projects. We have the UNHCR project, which has been ongoing for some years now. We are working for the Ivorian refugees who in 2011, had to come to Ghana, and then they have been around. Some of them are not going back. And so we have over 6,000 around that we support in terms of livelihoods.
Okay.
So yes, that's ADRA's role. We support them in farming, in poultry, and some other income generating activities. And so that also was somehow affected.
Okay.
We are doing it in 4 camps in 3 regions. But then the challenge was that the social distancing, so if even you need people to come for training or registering them, it becomes difficult. You can't do so much. And so it was affecting that project as well. The staff still worked though, because they were in the areas where the lockdown had not been affected. And so they could still work. But then the response for the from the beneficiaries wasn't that encouraging.
Oh, really?
Yes, because they don't want to come out. They want to stay. The idea is stay at home.
Right.
If you have nothing else to do outside, stay at home. So if you invite them, everybody is sort of scared. And I will tell you about the batch project later on. But
okay, I'm looking forward to that.
Yeah, that was also an experience. Though they are at the camp, still they were very cautious and careful not to contract anything. Yeah, so that one, we are hoping that now that this thing has been lifted, they can do a little more than they were doing during the lockdown period.
Right. Yeah.
Now we have another project we call iRise. It's reintegration of returnee migrants.
Oh yeah, that's the GIZ one, right?
Yes.
I remember.
From they are migrants from Germany, from other places, Libya, and all those other places. So we support them, reintegrate them into society. We provide them with some livelihood and all kinds of things so that they can feel at home. Having returned, that they will feel at home. So that also was affected because some of them in reinstating them, reintegrating them, you also have to buy them items that they will use to generate income. And so, like for instance, those who opted to have a cold store so they could sell fish and some meat, you can't go out to buy the deep freezers and those kinds of things. And even contacting them becomes a problem because, the notion is they have come from outside. And, our case started with those from outside. So you are even scared, So it was from both ways. Our staff were careful and they themselves were also not sure. So it slowed down the work. Generally, I must say that it has slowed our operations, but we are hoping that with the lifting of the lockdown ban, we may be able to partially improve upon what we were doing. So that's the iRise project.
Okay.
Yeah. And then we have the BAT.
Yes.
Which you are involved in.
Yeah.
Yes. The BAT project, we also have some challenges with it. Because, we have targets for every quarter.
Yes.
And so you have to achieve those targets.
Yeah.
But once the COVID-19 situation came up, then it was difficult getting people around. This is the time to do the nut collection, the cashew nuts collection. This is the period from January to May is the peak period. And that's the time we also teach them, train them as to how to pick them, because it is recorded that every year they lose about between 25 and 30% of the nuts because of the way they pick them. So since last year that we came out and started training people, the nut collection has really improved.
Okay.
And the government staff, that is those from MOFA, Ministry of Food and Agriculture, the extension agents, are so happy. I mean, we trained them. So they are really happy. They didn't realize that they were losing so much. And so this is the time we should be doing the training so that the nut collection will continue, but we are unable to do it because where you have a group of, let's say, you could train about 20, 30 people, you have to divide them.
Yeah, of course.
Yeah, into smaller units, and still they don't come. And that applies to other training activities that we're supposed to do. Besides the nuts collection, we also are supposed to register new farmers within this period. And the farming season is just about to take off. We've gone through the harsh period of dry season. Yeah. Now we are entering into the rainy season. And so farmers have been preparing their land and all that. So this is the time they need the training so that as soon as the rains begin, they can start also planting their seeds. But it's now a challenge because they've not been registered. We haven't been able to even train them. I mean, you haven't registered them, so they can't even register, train
attend the
them.
training.
So selection, registration, training are all being delayed
Okay.
because of that. There were some other activities that were ongoing earlier, and we thought that we could continue some of those trainings. Technology adoption, you know, managing the cashew farms and those things were trainings that were to be done, should be ongoing. But those ones too, you invite people across the districts.
Yeah.
You invite people, they don't come.
Yeah.
Where you have even divided them into 10, and you expect at least 8 to come, only 3 may show up. And you know, so it makes it very expensive even to run the project. You know, so there are cost implications, because if you have to divide, you could have done 40 at a time.
Yeah, yeah.
Now you have to divide it into 4.
Yeah.
And not all of them are even showing up. And so it makes it, you have to go and come a number of times, fuel and all other cost implications may come in. So that's the situation with it. But so the nut collection, the registration of new farmers, and the training, the technology adoption training have all been delayed. Another activity that is very critical that we should have been working on during this period is the stakeholders meetings.
Of course, about the value chains, right?
Yes, this is the value chain. Yes, and it's very crucial, because this is the time you have the aggregators and the exporters around. When the season is off, you don't see them.
Yeah.
You know, so this is the period, because now they are picking the nuts. So the exporters are coming around, aggregators are putting them together and all that. So it's very easy to call for a stakeholders meeting and they will show up. But after May, if we are unable to do some of these things until the end of May, certainly we cannot meet our target, because you can't get them.
Yeah.
It involves, with the value chain, it involves marketing and all that. And this is the time that we should be talking about it, but we can't.
Yeah.
So that's the
wow. Well, there we go. Like it shows you just how much of an effect this has, right? Like, yeah. And I think what you say makes sense about people not wanting to come, because if if there is one message around stay at home, so here the messaging has been very much stay at home, save lives. And I don't know if it's similar in Ghana.
Yes, it's the same message. Stay at home. As you come out only if it has to do with something very important.
Exactly.
And they say if you are going to buy food or going to the hospital or something, but other than that, stay home. And our president says that it is just at the door. So if you the virus is just at the door. So if you step out, then you can be infected. If you don't, you stay indoors, then you are okay. So that's the message that has been going on. And of course, vehicles, for instance, they don't allow them to take a number of people, because they should keep that distance. So there have been some challenges for public transport owners and things like that. They have had some challenges, because you see, you have to move this, cover the same distance, but with fewer people, and you are not allowed to also increase the fare. So those have been challenges, but generally, I think we are coming out a bit stronger. Let me even add something that may interest you. Because of the situation, Ghanaians are becoming very innovative.
Okay.
Because, the situation has called for us to come up with some ingenuity. So people are now developing certain things. For instance, nose masks are being fabricated here. They are making it right here in Ghana.
So what are they making? Sorry, I didn't.
Nose masks.
Oh, nose masks. Oh, wow.
Yeah.
Okay.
And they are, in fact, there's a factory that is also starting to produce the coverall. Yes, so the PPEs are going to be done from here. Maybe I will send you a picture on your WhatsApp about a guy, a young guy who has developed a container that has water and then with solar panel. And so you don't touch anything. You just place your hand under the thing and it gives you soap, liquid soap. You wash and then the water will come after 25 seconds. It has been programmed. Said that,
Wow.
yes, it's after 25 seconds, then the beeping will stop and then the water will flow and you wash your hands. He has developed that. I understand the UN even met the guy a few days back. You know, that's a young guy, and that's one of the things that people are doing. So all kinds of things, innovations are coming up because we have been challenged.
Yeah.
So
That's great. Yeah, please send that to me. That sounds really
I will send that to you. Yeah.
I wanted to ask actually about, so in the last 21 days, except the testing and the contact tracing that you mentioned, in terms of any kind, has there been any kind of effort, like, I don't know, whether it's kind of distributions or making sure that the most vulnerable have been protected?
Yeah, thank you. It's good you asked that. In fact, during the lockdown period, the government was distributing food. They used some NGOs, they used local NGOs or civil society organizations, they used some churches to also do the distribution. There have been complaints, of course. If you are doing such a thing, there will always be some complaints here and there, but generally the vulnerable people were being given food. Yes, some received raw or dry food items. Others received the wet one, that is, they were cooked. And so that one was being done every day. Some ministries were involved in rolling out that. So it was part of the government's plans. Besides that, churches themselves also were doing something like that, supporting their church members. Like in my church, for instance, we initially, when the lockdown was announced, we had 11 people we felt were very vulnerable. We supported them, and later our district supported them again. But then afterwards, when it was extended for another week, we realized that more of our members were going to be in trouble because they are on their own. They are self-employed. They go out, do some trading, and then make an income daily. So if they are locked down for 21 days, then it's going to be whatever they may have saved won't even suffice. So the church identified about 56 people, and we provided them with some food items last weekend.
Okay, nice.
So, and some of the conferences have done that as well.
Yeah, we're doing a similar thing here. So we have some hubs, I think at the moment 38, that are linked to, I think, churches, and then looking after members of the community, right? So with food distribution, or even, I think also if they need a chat or they're lonely or something like that. So yeah. And I wanted to ask, so kind of finally, because I don't want to take over, it's already 12, but I wanted to ask how you see the situation going forward. So you said now you're emerging out of this lockdown.
Yes.
So things will kind of go back to normal, if we can say, or kind of what plans do you have in place, or what is your vision here?
Okay, thank you very much. I think I should say that now we are coming out gradually, but still people are very careful. And so we hope that education will continue. Yeah, the radio stations, the TV stations are all doing the education. And so it has to continue. And I'm happy that during this time, most of the private media houses, gave their time to educate and to promote some of these things. So they did very well. Their prime time was used in broadcasting and making people aware that this is real. COVID-19 is here, and so and now people are very much aware. Let me also say that we have 16 regions. So far, we have those that have been confirmed are found in 10 of the 16 regions. 10 of the 16 regions. So that's the situation. Now, coming out of this, as a nation, I think that we are going to slow down. It will take us some time. Yes, definitely it's going to take us some time before we bounce back fully. Because still people are scared. People are, vehicles are not found seen mostly on the roads, people are just, and then there's a new thing, which is good. From this experience, we have realized that we don't really have to come to the office to congregate at one place to do work.
Yeah.
And it will interest you to know that 3 weeks earlier, before this the ban for schools not going to, the closure of schools and those things, there had been a meeting which I was invited to attend by the National Development Planning Commission. And there, the issue came up. It was a huge issue that came up, that should we always come to the office to work?
Okay.
and that who even indicated in our labor laws that work should start at 8 a.m. and end at 5 p.m. Who said it? But we are supposed to work for 8 hours. But it's not in our books that it should start at 8. But somehow by convention, it's been done 8 and then 9 up to 5. And then the challenge is, in the morning you have huge traffic.
Yeah.
Because everybody has to get to the office by 8. And then 5 p.m. people have to go. And so there's huge traffic. So a distance that you use only 20 or 30 minutes to cover, you are spending more than 2 hours in traffic. And that alone put a lot of stress, and diseases will result as, eventually, And so that was being discussed. Then this thing came out. And now we have seen that, we can even operate from the home. Okay. Now so that is going to be one of the things that I'm sure Ghanaians are going to work with. Like, for instance, in our office, I've indicated that tomorrow, God willing, as we come, we're still going to ask some people to stay at home and work from home and give us their reports. Like Joseph, and Joseph.
Of course, yeah.
We want him to stay at home. Ben, those ones, they can stay at home, do their work, and send them to us. So we will do that. And so that's one thing. For ADRA, we are here to do our initial response. Okay, ADRA Ghana. We have received some funds from ADRA International, but yes, and then the local unions have also contributed their part, and so we have it. And what is $30,000 in total, and so we have ordered for some items, PPEs, from China. The reason is that the prices here were too exorbitant. Yes, and so items that the money could buy, buy only 100 in Ghana, we could get almost 500 of the same in China. So, and there is a company that our Ghana Adventist Health Service works with, and so they have been tasked to get us the items. In fact, there has been a delay, and it's because of the COVID-19 situation. So there are a lot of items packed at DHL office in China, we are told. So we are hoping that before the end of the week, our items will arrive so that we can make the necessary donations to the various institutions. And in addition, the church is also going to make a donation because the government set up a COVID-19 fund. And several organizations, private institutions have all contributed. So we are hoping that the church also in Ghana will make a contribution. That has been decided. The church in Ghana also has, I'm talking about the Seventh-day Adventist Church, has also set up a COVID-19 coordinating committee.
Okay.
ADRA serves on that committee. We play a very key role in that. And the idea also is that we are going to continue observing, monitoring the situation, and giving a counsel to our churches and church members. So, and Hope Channel is part of this. Hope Channel Ghana, Hope Channel Ghana, and they started also raising some funds. As we speak, I don't have the figure right now, but as at yesterday, we had raised about 134,000 Ghana cedis.
Oh, wow. Okay.
Yeah.
Great.
Yeah. And so the idea, when the committee met, the idea is that they would channel the funds through ADRA to do humanitarian services. So we are going to do a quick needs assessment, identify needy people in these communities where the lockdown affected, and see what can be done. So that's what the funds will be used for.
Okay, but so I just wanted to ask, you mentioned the PPE.
Yeah.
But specifically, who is it for? So is it for the health?
Yeah, that one is for the hospitals.
Okay, so
yeah,
that's part of the
we have some hospitals that need some support. In fact, the need is huge, you know.
Everywhere.
One of our board members, he's a medical doctor, and he is in charge of one of the centers for the confirmed cases. He has the largest number. And when I asked for a list of items they would need, I was surprised. They need 50 PPEs per day.
Yeah.
So it's a huge number, and that's only one center. Of course, they have the highest numbers too, and then the other places. And so we thought that though the government is bringing in, some people are donating, we thought that we still have, it's a big need, and therefore we should be able to support that. And so eventually we're going to make donations. We also have the intention of supporting the Seventh-day Adventist health facilities. We have 29 hospitals and clinics. These are all frontline facilities, because before people are referred or is confirmed, they will go to such places. But they don't also have these protective equipment. No, they don't. So we are saying that we will also be supporting them. Yes. So when the items come, part of it will go, 80% will go to government institutions of hospitals, and then 20 will go to our gas hospitals and clinics. And the Hope Channel funds, part of it will also be used to buy additional items, PPEs, and infrared thermometers for.
Awesome. Yeah. Wow. Wow. Well, it sounds like you have a lot of work in the next year. But no, that's been it's been really, really interesting to hear about that. And I think because sometimes it's different, you know, when you can read the news and say, like, you know, Ghana, this is happening. But I think when you speak to somebody on the ground, who really, who, you know, who's living, I guess, the situation. So it's been great. Are your borders closed?
Yes, our borders are still closed.
Okay.
So those earlier, directives are still holding, that our borders are still closed. Schools are out of session.
Yeah.
And so those are still in place. From kindergarten to the university, they are all at home. Yeah. But another benefit is that now they have come up with electronic approaches in learning. So the Ministry of Education has come up with lessons, that are to be taught. They have them on in video forms. Television stations are telecasting them and all that. So the children are at home, yet they are learning, and they can also go on to certain websites and download the lessons that are being taught. Yeah. The only challenge for some of our young people is that this is the time they should be taking examinations. In West Africa, we have common examinations for some countries. We have one examination, and the West African Examination Council has had to suspend all these examinations. We don't know when the children are going to write. Those that are preparing for the university, those that are preparing for the senior high school, these are two different exams, and it should be held within this time up to June, but it ends up delayed. So that's also something that is on board. Yeah. Cargo is able to come in though.
Okay, yeah.
Not, yes, and our borders are still closed.
Okay. Well, I mean, I hope that, now kind of with the relaxed measures, things will feel a bit more normal, and that, you'll be able to kind of, as you said at the beginning, that the fear and the panic will kind of subside completely.
Yes, it has subsided.
That's,
it has subsided. Yeah, it has subsided. But still, people feel that, we are divided as Ghanaians. Some feel that the government should have extended it even for another 1 week.
Yeah.
Because within 1 week, we moved from 566 to 1,000.
Yeah.
So some people felt, if it had been extended for another week, probably, but the decision is based on what the professionals say.
Exactly.
They were doing their contact tracing, and they feel that I think they have reached about 80,000.
Okay.
Yes. Wow. And so with that, they feel that we are okay to lift the lockdown.
Great. Well, we are in lockdown, I think, for another 3 weeks.
You have been for 3 weeks?
No, maybe 3 weeks, or this is week 4. I can't remember, but it's been extended until for another 3 weeks.
Oh, for another 3 weeks. Oh, wow.
So.
Then we are enjoying our freedom.
Well, yeah. Enjoy your freedom. Great. Let me stop recording this. So there's one thing I do want to say. But yeah, thank you so much for your time. And it's been really, really interesting to hear that.
Thank you.
And all the best with the response.
Thank you. I hope, you edit it and those areas that you